Okay. So today is April 24th, 2020. It is 10:34 a.m. My name is Isabella Oliver, and I will be conducting this interview with Dr. Jeanne-Marie Stacciarini and Aliya Miranda. Dr. Stacciarini, if you could please spell your name for the person who's going to be transcribing this interview.
Yes, it spells Jeanne, Marie, Marie, and the last name is Stacciarini, Stacciarini.
Thank you so much. And if you could just tell us your date and place of birth.
Mhm. Okay, in general, I don't tell my age. Is that a requirement?
No, it's not. It's
I'm
just your date
kidding.
of birth.
I'm kidding. It's March 4th, 1964.
Okay, thank you. And where were you born?
I was born in Minas Gerais in Brazil.
Okay. Great. So could you tell us what your journey has been into healthcare as a profession in general?
Yeah, I graduated in nursing. My bachelor is in nursing, and after that, I had some opportunities of working in different places. My first place of working was in Amazonia, where I worked as a nurse for some tribes. Then I work as psych and mental health facility. I was nursing hospital, inpatient, and then I also work as a nurse in outpatient hospital in Brazil. After that, I did my master in mental health and then my PhD in social psychology. And from that, I think right after I finished my master, I start teaching. So this is something I've been doing for a while. And I have had the opportunity of doing work in Brazil, in Mexico, and also in the US. So I've been in the career for a while.
Okay, thank you. And what led you to want to become a nurse and study all of these issues?
Uh, I don't know. I grew up in a family where my dad was a physician, and I start early on seeing the work that he was doing. We live in so many parts of Brazil, and he was only the only physician in all the places that we lived. So I kind of early on learned my passion for taking care of people. But I learned also that I didn't want to do exactly what my dad was doing, like going there and doing some, you know, dressing or some kind of physical thing. I always love to talk to people. So I think that inspired me to find um, my way of being a healthcare professional, and I decided for nursing.
And how did you come to UF?
Um, in 1998, I had the opportunity, I was doing my PhD program, and I had the amazing opportunity of being a Fulbright scholar. And as a Fulbright scholar, I went to the University of Massachusetts in Amherst, and I studied with a tremendous researcher, Dr. Epstein. After that, I went back to Brazil, and then for more personal reasons, I decided to come back to the US. When I came back was 2001. I got a job as a faculty at the University of Massachusetts in Amherst. And then in 2006, I decided to change universities. And the main reason initially was the weather. You know, it was hard for me being, from Brazil, where the central part of Brazil, where you have summertime all the time, and dealing with, snow was something very hard. So I decided that I want to come to Florida, but also I had in mind that going to a place where they would facilitate my research work. So coming to RO1 University was something that I had thought about it, and I decided because I really wanted to invest more on my research.
That's great. And can you tell us a little bit about your research?
Yes, I do have a passion for health disparities and in different populations. So I have worked with different minorities group, and recently I'm working mostly with migrant farm workers, trying to understand social determinants of health and how those can be related to mental health. Also, last year, I decided to invest in another area, which I think is being so impacted in terms of health. And I decided to start working with the LGBT group, and I do have one research funding to work with um, kids starting 11 years old to 17 who self-identify as member of the LGBT, as part of the LGBT group, particularly those living in rural area, because I think rural can influence their health. So more specifically, I've been concerned about how their sexual orientation and the social issues related to the sexual orientation and the geographic area can impact their mental health. So more recently, I'm working with those two groups, migrant farm workers and LGBT kids, and always related to social determinants of health and mental health.
Okay, and when you were becoming a nurse and you were getting into your career, how did you learn that there were these healthcare disparities in healthcare?
Uh-huh. Very early on, as some people know, Brazil is a unified public health system. So I did have the opportunity of having clinicals during my bachelor program with a very diverse population. So one of the things that I remember was, going to favelas in my hometown and trying to do some health education. So I was exposed. I had the great benefit of being exposed early on the theory of oppress, which is from Paulo Freire, an educator, a philosopher from Brazil. And he talked about how important it is to analyze social, political, economic factors that can be related, in this case, with education. In my case, was with health. So I start very early on. Perhaps that time I didn't have the researcher mind that I do have today, but I was exposed very early on disparities in healthcare.
And how do you think these disparities are different, for example, in Brazil versus here in the US?
What is different?
Yeah, like how do you see the disparities shaping
Oh,
out Brazil
oh,
versus here?
uh, there are some large differences, and there are some similarities. Um, I think disparities are all over the world, and the disparities can be related to socioeconomic, can be related to racism, can be related to um, sexual identity, can be related to culture, language. There's so many aspects that influence health disparity. In that regards, I think there are similarities, but there are differences because the healthcare system is so different. Um, we do have in Brazil the unified health system, which is health for all. So perhaps they will not receive the best quality. Perhaps they will be standing in line for to be seen a nurse or a physician, but they would have the possibility of accessing. And here in the US, we do have, I cannot tell you the numbers right now, but we do still have a large number of people who do not have access to health, to health treatment, to immunizations, to basic health care. So the population that I work with, the migrant farm workers, is one of them. We do have around 2 to 3 million people working the farms as migrant farm workers. 80% of them are from Mexico or other parts of Central America. And the large number of those, they don't have access to health. And they are the ones who are, you know, getting the food that we have every day in on our tables. So I think that is a huge health disparity. So answering in a short way, there are some, you know, common disparities, but also there are some differences.
Thank you. And so, what are the types of disparities that you feel most concerned about?
Oh, I think all types of disparities are in my radar. Um, of course, as a researcher, I have to select some aspects, and also disparities um, sometimes is a multivariable aspect, is not one single characteristic. So I would say that for my research, I've been studying more how the social and the geographic disparities can affect particularly mental health.
Okay, and I know you mentioned the farm worker community and the LGBTQ community. How do you think these populations and other ones that you've worked with have been impacted by healthcare disparities in general, and how they've also been impacted by the exacerbation of these disparities under COVID-19.
Uh, Tremendous impact. I just put a grant out today, very early in the morning, in fact, for trying to identify a little more about beyond what people were telling us, but to do like a research on the COVID with migrant farm workers. But they, particularly the migrant farm worker, as I mentioned, they have different social determinants. So culture, language, social economic, all of those aspects can exacerbate the risks for having getting COVID. For example, one of the things they don't have access to basic hygiene in their work environment. One of the things that we know is the most important thing is to wash the hands and to keep isolated. So that is not possible in their work. So they're going to be soon the hot spot for COVID-19. Another groups, those that work in forests, they have been laid off, and so they don't have jobs at this point. They don't have any income, and some of them do not have food on their tables. So they have been tremendous impacted. I just got another thing that came to mind um, is the World Health Organization just had a webinar last week talking about infodemic. And I think this population, particularly the migrant farm worker, is very vulnerable towards that. So, according to the World Health Organization, infodemic is the amount, this tremendous amount of information that we are receiving in digital platforms regarding COVID-19. Some information, and not only from the World Health Organization, we are receiving information from leaders that sometimes are misinforming the population. So, and our migrant farm worker population is tremendously vulnerable for that. How are they going to know what is the best evidence practice? We don't know yet what is the best evidence practice. So, but some people may be already taking some medications to prevent, which there is no such a thing. So, infodemic is a huge issue, particularly in vulnerable populations.
I think it's really interesting that you say that, because another person that we interviewed mentioned that especially within the Black community, they might not receive the same kind of information because they're not seeing it from like a Black representative in healthcare and things like that. So I think it's interesting that you say that, because it seems that in your experience, the farm worker communities do have access to all this information and they're getting it.
Mhm.
So how do you think that this is obviously going a little bit beyond the questions that I sent you, but um, do you think that they have access to, I mean, like a lot of information that they're receiving for the most part, all the updates regarding the pandemic, or that they have limited access?
I think it's a mix. I think it's a mix of information that they're receiving. So we know that some of the population, they do have, um, smartphones, and they are connected in the internet, as you know, a lot of people in this world nowadays. But they cannot understand, they don't have the ability to identify what kind of information may be accurate or not. And also, some of them may not be receiving the information from the internet. They may be receiving the information from friends, from family, and again, we do have the migrant farm workers that are doing tremendous work with this population at this time. But we also don't know how they are accessing this information and their ability to put it together, all the information that is out there. So I think it's a mix. Some do have the information and some others don't have. And some who have the information have fake news information. They have informations that are not evidence based, because we are just starting with science in terms of doing clinical trials regarding COVID 19.
Gotcha. And I wanted to bring it back a little bit just for clarification. You were talking about the social determinants of health that you analyzed in your research. Can you talk a little bit about what those are and how they shape into disparities?
Yes, there are some basic ones. Language. 70% of our population do not speak English. So it's hard for them to have the same kind of information, the same, and if they need some kind of professional healthcare, sometimes translation can get into the middle. Another thing is the actual culture. People have different beliefs. People think that, um, COVID 19, for example, it's just like a cold, and it's just one more virus that is coming. So there is a lot of misinformation, and those social health determinants can impact in a negative way, exacerbating the chances that people may have in terms of access. Overall, my research is towards the mental health. So, for example, people have different conceptions of mental health. Some people think that, are spirits. Some people think that I'm depressed because God wants like that, or this is a sin that I'm thinking. So there are so many varieties that culture, language, socioeconomic, insurance. The person may believe that depression needs to be treated, but they don't have access to specialized mental health care treatment. So that's the way we look into. And one very important thing that I teach my students early on in their PhD programs is like there is a big difference on health disparities and minority health, but sometimes they are connected. But health disparities can be in Black, whites, Latinos, um, homeless. Minority health is related to those racial and ethnical characteristics. Sometimes they are connected, but not always. So sometimes we do have statements like, you know, um, for example, I do have a colleague who is in California, and she does research with um, Black mortality during pregnancy. And one of the things that she alerts the population is it's not the race that is killing these women, it's the racism that these women are suffering. So there are some big difference to understand health disparities and minority health. And I think we have to be more aware of those differences.
Um, so going a little bit off of that, have you seen any instance related specifically to COVID-19 treatments that have been shaped by some sort of discrimination or racism?
Uh, I have not seen beyond what is in the media. So, because I am not in the front line and I'm not doing research with COVID 19 people who are in hospital. So, what I can tell you is just what Dr. Fauci said. You know, COVID 19 is really bringing up some of the disparities that we did have in the past, but now it's kind of exacerbating. He used an expression that COVID 19 is shining a bright light of an acceptable health disparity. And I agree with him, although I'm not doing research on that area at this point.
Okay, thank you. I guess the next question would be, how do you think we can support these communities through this time in general with healthcare disparities, but also through the pandemic?
Not sure I understood how we can support the community. Is that what you were asking?
Yeah, so especially the communities that might be most affected by these healthcare disparities, how can
Uh-huh.
we provide a source of support?
Yeah, I think the best way to do is to connect with organizations that are actively engaged with the community. So I think the best way, for example, with the migrant farm workers, I think the best way would be to connect with the organization. So they are doing some basic work. They are distributing food for those who don't have food. So there are some basic, like perhaps they need masks that they can work in on the field with masks. Is that something that the organizations have interest in public collaboration? We are seeing, for example, within the University of Florida, the Shields Hospital, we are seeing a tremendous response from the community. So, also putting out there awareness, it's a really nice way of saying there are other communities that also need your volunteer work, your dedication. We do have migrant farm workers that need masks to work on the field. They need hand sanitizers to keep bringing food to keep providing food to us. So I think putting out there, it's the most important thing. I've been telling a lot of colleagues that I have colleagues from different part of the world who have said to me, "Oh, I feel so disempowered of helping or supporting." So, and my response is people have different ways of uh, supporting the community. So I'm not there with the migrant farm workers distributing food, but I'm putting out articles out that bring awareness so people can join and understand the needs of this community.
That's incredible. Thank you so much for doing that because I think right now, especially, we need all the reliable and factual information that we can get in this age of disinformation. But do you know of any communities,
Uh,
not communities?
let me give you an example of one of the work that I just did recently,
Yeah,
if
go
you don't
ahead.
mind.
Yeah.
I was invited to write an editorial of a journal in Brazil, and so for me now it takes time to write in Portuguese, correct? And my first reaction was like, no, I'm not doing this. But suddenly I thought twice, and I said, you know, I'm just in a very privileged position that I can talk about COVID and some other aspects in Brazil. So I wrote to the person who was the editor who was inviting me, and I said, I'll be happy to write about COVID and how that is impacting the nursing profession. I would love to write about that. But I'm going to write in English and ask someone to translate that in Portuguese. And she said, oh, not a problem. So we wrote, and it's going to be out, I think, by next week. And basically, in Brazil, there is now this huge momentum to try to have um, the nursing profession at the advanced level. So in Brazil, they do not recognize nurse practitioners yet. Although they do have the education for the past 15 years, the role of the nurse practitioner is not yet recognized. So one of the things I wrote about is like how nurses who are in advanced practice are now providing an amazing care to the patients in need who have COVID-19. So I found the opportunity of advocating for the profession in another country using this. So I think that's what leaders should be doing. What kind of voice I can bring to the table for those that have some kind of oppression. So the oppression that nurses do have in Brazil is the fact that they haven't been able yet to have their role recognized. So this is just one more example of working to eliminate disparities. In that case, it's not necessarily disparities, it's health related, but it's not the health of the nurses, but it's the work that they do. Sorry, I interrupt you.
No, 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 no. That's incredible. Congratulations. If if you would like to share that when it does come out, we would love to read it. That is really, really interesting because I don't think I had no idea that that was the case with nurses in Brazil. Um, and going off of that, I've been seeing a lot of um articles in the media about a lot of protests in Brazil that they want to like reopen back the country and I guess leave quarantine. And how do you think, this kind of lack of official and factual information inform those kind of decisions?
Yeah, that is, one of the disparities that I think we haven't yet study as actual disparities, but it's I'm sure um, and the people involved in political studies, international studies, going to be doing or are already doing something on that regards. We can see places where leaders are more open to science and the impact that they're doing in their own countries. So, unfortunately, Brazil, as well as the United States, we do see a negative political impact. So, our leaders are not pro science. And that's it's going to reflect on the most underserved population, unfortunately. So, yeah, so I think we are on the same page in Brazil and in the US in terms of how our leaders, I'm talking about the nation leaders, are responding to this pandemic.
I think also there's I mean we think about this a lot as like country versus country is what we're seeing a lot of the rhetoric in the media regarding this pandemic, and um, I think we're really not seeing it as a global issue that we all are responsible for one another.
Mhm.
Can you kind of speak to that rhetoric and what our responsibility is to the rest of the world in how we deal with this
Yeah,
pandemic?
yeah. I love you were asking this question because pandemic situation is not one to one. You know, pandemic situation is a community issue and it's a global issue. So I think the World Health Organization has been tremendous in terms of working in different needs and responding to the global issues. But then we do have nations that are receiving that support in different ways. Some nations are accepting with open arms and say, here's how we're going to handle the issues. And some nations are saying, I I don't believe on that. So, for example, we did have recently, you know, our leaders who did not sign the agreement with the World Health Organization. So that is one of the tragic, tragic thing that could happen at this time. So it's just saying, you know, we don't need them. We do need them. This is then a global issue. The same thing for the infodemic. In order to deal with infodemic, we have to consider how culture can impact the way that people receive information. And we do have so large varieties of culture and languages, and so there are many aspects. Totally agree. Totally agree. So some people are thinking the kids can go back to school because the chances that they're gonna get is very uh, small. However, the kids gonna go back to school, they're gonna be asymptomatic and they're gonna bring to their grandparents, they're gonna bring to their parents. So this the transmission is not visible. So this is something that anyone can acquire, but we do have higher risks when we don't have like strategic planning from above that can support the work population are doing. This is not a time of fighting. We are already in a war. Uh, you know, this is a war. People are in the front line trying to trying to give life back to those that are severely ill. Why we are not thinking of the global perspective. So I think this is particularly difficult because we have become a more individualistic society. So this is not my problem. This is my neighbor problem. This is not my community problem. This is not the world problem. So that is a cultural shift that needs to happen in people's mind to think COVID as a global perspective.
And going a little bit back to the organizations that you were mentioning that are doing a lot of work in providing personal protective equipment and other resources for the community, do you know any specific organizations that are doing that?
We have as a collaborator, a direct collaborator, we do have the Migrant Farm Work Organization in Florida. So Dr. Tovar is one that has been frontline with the migrant population and frontline at national level, educating, bringing awareness about the migrant farm work issues at this time.
Thank you. Aliya, do you have any other questions?
I really don't, but are there any other things you think are going to be really, really important to include in this archive, or any other people that you think are going to be really important to speak to for future interviews to include in this archive?
I think what I could include there is in this current situation, I think I have touched on that, but just to emphasize that every single person can contribute somehow, and the contribution is going to be different. For example, I talk to my daughters who are teenagers, and I say, "What are you doing to make a difference in this difficult time?" And they say, "Mom, there is nothing I can do it." I said, "You can do it. You know, some of your colleagues may be anxious about germs. Some of your colleagues may be experiencing some mental health issues or exacerbating some mental health issues. Reach out to some of your colleagues. Say, hey, do you need to talk? Um, do you need to have someone to listen to you?" So they did. And there was one colleague who was calling. Initially, he was calling every day. I said, it's just a little too much. Let's do that twice a week. So I think every single individual can contribute. And perhaps they don't see their contribution, but when we are reaching out to one another, we are making a difference in this world. When we are, putting out some information that are reliable and accessible to people who don't have it, when we are writing in another language that others need to, we are making a contribution. So there are very different ways and creative ways that people can make a difference during this time. So this is my, my emphasis. Every single one can contribute. And then this will not, what we are living now is so unique that's going to impact people in so many different ways. The mental health issues that's going to come from the isolation, from being on the computer day and night is going to be huge, huge. again, that's going to be our, uh, we need to invest what we are doing, what we are. For example, in my college, I'm the assistant dean for diversity and inclusion. So I meet with faculty, and I have shifted a little bit, and now we are talking about diversified ways of well-being. So how people can encounter their inner peace and how they can support each others in this difficult time. So I think everyone can contribute.
That leads me to what I guess would be the final question.
Uh-huh.
So in your role as assistant dean, how do you think that in general, like professors or faculty have been trying to support students during this time, especially because a lot of students are, we're not all equal. Like some of us have different circumstances that might place us at a disadvantaged position. So how do you see faculty handling that and supporting or not supporting their students?
Uh, I can't speak for the faculty in my college. They're working above and beyond to be understandable, to be supportive, and so it's just sometimes we don't have the expertise in all cultures, and sometimes people don't know all the disparities that people may be under. So I think we are doing above and beyond. Last week was the last week of a program that I do have in the College of Nursing. So it's a program, it's called Embrace. It's engaging undergraduate students, underrepresented undergraduate students in leadership and research. So that was the last week and was online, and we had some kind of celebration. We had students who presented, and I always use social media as a way of voicing things that we are doing positive and things that are challenging in the profession. So I post out there to celebrating the Embrace end of the year. And one student she's not a student anymore. Now she's a nurse in the front line, and she was in the Embrace program 2 years ago. And she said, Dr. Stacciarini, congratulations once more on this program. So she responded to me, and that triggered me to talk to her a little more. So I went and I messaged her and I said, "Hey, how's it going? I know that you are a nurse now. How things going with you?" And she said, "Crazy. We are working crazy day and night. Plus, we don't have protective equipment as we should." And she said, just to give you an idea, I've been with the mask I-95 for the past 5 weeks. So the same mask she's been using for the past 5 weeks. So I could not believe that. So I reached out to one colleague who is the lead of the lab in the college, and I said, is there any masks that we could be donating to this girl? I know that we have hundreds of nurses that are in the same condition, but we made a difference in her life. So we sent, I think it was like 10 masks to her. So just doing those things, it's so, when you think it's small, but it does have a tremendous effect. So we can affect so many people. And I think our faculty are doing that. Our faculty are trying to, I think they're trying to see what they can be doing. So, for example, today I received a message from a colleague saying, "Oh, here's what was in the newspaper. We are just starting Ramadan, and people don't eat during Ramadan for a long period. So some of the students may not be in their best physical and mind to take the exams." So I say, let's put it out there to the faculty to be knowledgeable about this. So I think within capacity, we are doing tremendous. Of course, we are human beings. In everywhere you're gonna find people there are just saying, "This is not my work. I'm here not doing." I don't see that in my college. I see people up front. I see people donating time. I see people engaging with students. We had a junior student that went back to her country. She is from one island in the Caribbean, and before she reconnect with her family, she was mandated to be in quarantine for 14 days. So she was in a hotel room for 14 days without seeing the sunshine. So we were texting her every day. We were aware of that. We were trying to facilitate things, but not all the students are able to open up about the circumstances. So we are trying to do what we can.
Well, thank you so much, Dr. Stacciarini. The interview has been great. I think we can end it here, the recording, if there's nothing else that you would like to mention.
Sure.
Okay, so let me go ahead and stop recording.